Good morning, everybody. Thank you for being here today at the Informational Picket. My name is TJ Ziskowski, and I'm a labor and delivery nurse here at Maple Grove Hospital. For 23 years, I've worn a stethoscope around my neck, advocating for patients, serving my community. I began my career at Alina, continued at HCMC, and for the past 7 years, I've been proud to serve patients here in Maple Grove. Today, we are reminding hospital leaders that Maple Grove nurses are standing together for a fair contract. Woo! A first contract that provides affordable health care, sustainable schedules, retirement benefits like a pension, and real investment in recruiting and retaining skilled nurses. Because this community deserves the continuity of care that comes from experienced nurses staying at the bedside. I chose to come to this community to help provide high quality care to mothers and families choosing our hospital to start their families. But hospital leaders continue to ignore the high turnover among Maple Grove nurses. And when experienced nurses leave, patients lose stability and expertise that safe care depends on. In the last 3 years, Maple Grove nurses have left this hospital at alarming rates because they lack those sustainable benefits and the respect nurses deserve. Benefits that would prioritize nurse retention and patient safety. It's simple. We're asking for benefits that align with other metro area union contracts. A fair contract for nurses at Maple Grove Hospital is an investment in this community. Nurses live here, raise families here, and are a part of the same community that we serve. We're not just employees, we're neighbors, caring for our neighbors. Do you know how many nurses are standing together in this fight? Nearly 600. Despite months of frustration and ineffective bargaining sessions with hospital leaders, nurses continue to fight for what matters most: high quality patient care. Patients deserve skilled nurses at the bedside. And if hospital leaders fail to retain and recruit nurses, more nurses will leave Maple Grove. Hospital leaders must acknowledge that now. We take care of our community, and today we're asking our community to stand with us. When healthcare workers are supported, patients and communities are safer. Thank you.
Good morning, everyone. It is fabulous to be here with all these amazing, strong, incredible nurses. My name is Margaret Sampson, and I am a labor and delivery nurse here at the Family Birth Center at North Memorial's Maple Grove Hospital. I've been a nurse here at the hospital for 10 years. I love being a nurse, and I feel lucky that I was able to start my labor and delivery career here in this community. What I don't love is the lack of respect our employer is showing us. I've seen firsthand over the years how things have changed here. We deserve respect, and respect should not depend on which North Memorial Hospital you work in. Respect means benefits that are on par with what nurses receive at other union hospitals in the metro. Patients truly deserve one North, one system, where nurses at Maple Grove are respected and treated as the same as the nurses at Robbinsdale. We want nurses to start, build, and finish their careers at Maple Grove Hospital. But that only happens if hospital leaders respect nurses with a fair first contract. Without respect, without parity, Maple Grove Hospital cannot retain nurses in this community. The hospital cannot ignore their success is on the back of nurses like us. I love this community. And this community is why we are here today holding this informational picket. It is why we care and why we fight. The truth is our community will continue growing, and we welcome that growth. But that growth means the hospital must retain, and recruit experienced nurses. We can only deliver the highest quality of care if we keep these highly skilled nurses at Maple Grove Hospital. We are disappointed in our hospital leaders. They're choosing to not prioritize nurses because when nurses aren't prioritized, patients aren't either. It ignores how important Maple Grove Hospital is to this community. Let me be clear. Nurses are committed to caring for Maple Grove. Now, hospital leaders must show the same commitment to this community by taking nurses' concerns seriously and negotiating a fair first contract that aligns with other union hospitals in the metro, including with North Memorial Robbinsdale. Thank you.
Good morning, everyone. It's great to be here on this beautiful day. My name is Julie Knorr, and I'm a patient care facilitator in the Med-Surg Care Center at Maple Grove Hospital. I've been a nurse for 22 years, 5 of those at North Memorial's Robbinsdale Hospital before I came to Maple Grove. I started at Maple Grove Hospital 2 weeks before the doors opened to this community, and I've been here ever since. I've been here since the beginning, which means I've worked with hospital leaders for decades. For 16 years, the nurses at Maple Grove have been paid less and treated as less than our colleagues at Robbinsdale. We knew a change had to come. That's why nearly 600 nurses voted to unionize over a year ago. We've had 25 bargaining sessions with the employer, and far too many of them have been disheartening and frustrating. For years, nurses have been expected to rely on promises and well wishes instead of a real contract. But nurses can't build a future on well wishes. Real change only happens when it's written into a contract. Instead, hospital leaders want us to keep with the status quo. Less affordable health insurance and less retirement security like a pension. And for nurses like me who are close to retirement, that means less of a chance for a secure future after giving our all to this profession. I'm speaking to you as a nurse who cares about my future, my fellow nurses' futures, and most importantly, the future of the patients who walk through the doors of Maple Grove Hospital. Nurses at Maple Grove cannot be left behind if North Memorial wants to continue delivering the level of care this community depends on. After all these years, I still choose Maple Grove because I love and care for this community. But I know if we don't fight for this fair first contract, our patients will suffer. This hospital can't afford to lose experienced nurses from this community, especially when retention is already a challenge. We're asking hospital leaders to stop treating nurses as replaceable and start valuing nurses as the experienced professionals they are. We ask the community to stand with us and tell hospital leadership at Maple Grove the nurses deserve a strong first contract that aligns us with other union hospitals in the metro, including North Memorial Robbinsdale. Because support and care for Maple Grove nurses means support and care for the Maple Grove community. Thank you.